People will hear me well, yeah?
Hi everyone, this is Ryan Hoyme, aka Massage Nerd, and tonight we have a special guest, Boris from medicalmassage-edu. Welcome, Boris.
Hi, Ryan. Glad to be with you.
Yep. So I've had you on my show a few times and stuff. So tonight we have a few different topics that we can cover. First one is TMJ. So what got you interested in TMJ problems or dysfunctions and stuff?
Okay, Ryan, before I will start discussing temporomandibular joint dysfunction, I want to tell you that I enjoyed to meet you first time at World Massage Festival. Yeah, and I always knew where you are there because I could hear you laughing. I knew Ryan here. Yeah, you laugh. It's it's very difficult to imitate you laugh. It was good, and by the way, additional time would like to congratulate you for receiving industry award. You well deserved it, and you probably heard me screaming and clapping for you.
Yep.
Yeah, I like it. Okay.
Yep, you were recently inducted to the Massage Therapy Hall of Fame too, so congrats on that.
Whoa! Yeah. Congratulations. When you were there? Oh, me?
Yeah, you.
Last year I was inducted in Hall of Fame.
Yeah.
Oh, yeah. Thank you very much. Thank you. Yeah. Okay, Ryan. Let's go back to temporomandibular joint disorders. The TMJ is very hard-working joint, if may I say this way. Approximately during the day, we're moving it, we're engaging it 2,000 times. When we're chewing, when we're talking, when we're thinking, yeah, 2,000 times. It's very hard working joint. This joint composed of mandibular bone and temporal bones. It's creating the joint. In the end of a mandibular joint, it's a very important fact to mention. We have attachments to condyle, mandibular condyle it's called, attachments of cartilage. It's called disc, it's called meniscus. In different texts you can hear different names, but this is the same piece of cartilage, and this mandibular when we're opening, sliding on this cartilage. All stabilization and movement of within a temporomandibular joint, within TMJ, provided by masticatory muscles, chewing muscles, masseter, pterygoid, medial, temporalis, this very big muscle, temporalis flat, very big muscles. All these muscles working in assembly, providing stabilization of these joints and of course, movement. Nowadays, dysfunctions of temporomandibular joint taking pandemic proportion. People suffering from these dysfunctions significant, and symptoms of these dysfunctions. A lot of people cannot chew hard food. They can, because it's producing a lot of pain. A lot of people suffering from tension headaches. Tension headaches is tension in masticatory muscles will produce headaches. Neck also, tension with the neck. We will talk a little bit about neck too today because it's important to address. When we're addressing temporomandibular joint disorders and dysfunctions, we have to address neck too. I will extend on this a little bit. And all this producing tension headaches, and 45% of adult population in United States of America suffering from tension headaches, and temporomandibular joint dysfunctions contributing a lot. I'm positive. I see it daily. I'm treating people with tension headaches, and I always addressing temporomandibular joint, these masticatory muscles, chewing muscles, you can call it also, and it does help. All these painkillers and dentists doing night guards. It's help. It's kind of at the time of bruxism. One of the causes main causes is stress. And nighttime, a lot of people stress so much they doctors, dentists, they're creating night guard piece in mouse. The problem in most cases it's making even worse pain and etc. Because when they're doing measurement, this measurement not really realistic due to tension within masticatory muscles. Then what happened? The person accumulate more tension, and then this piece he biting like this, and mandibular falling back in traumatizing this cartilage meniscus in the end of the condyle, of the mandibular condyle. The temporomandibular joint disorders is a pure start on level of muscles, and this is pure muscular syndrome, making headaches, making people not capable to open mouths. A lot of people trying when like this and screaming because it's kind of shocking, firing pain. All this developments start on level of over tense, pathologically tense muscles within temporalis. I hope you can see on the camera temporalis, and masseter, pterygoid muscles, lateral pterygoid, and medial. You can reach it through cavity of mouth. Now, with all available methods to treat this dysfunction, to help people to get rid of these symptoms, all available methods, massage therapy is most effective. Massage therapy really most effective because, like I said, all start on level of muscles. Of course, fascia also will get this involved by accumulating tension, and we actually with our hands we're addressing tension within muscles, we're addressing and releasing tension within fascia, we're addressing trigger points, all of them equally important in order to sustain results. All these modalities such as massage, mobilization of fascia, mobilization of muscles, trigger point therapy, all these methods is equally important to sustain results. Not only release little bit, oh, I feel good, but to sustain results. This is briefly my introduction. All viewers, you're welcome to write questions. I will answer. We have plenty of time, and then I will continue. By the way, I would like to mention tinnitus. You know, it's zooming, ringing in ears, and it's many ringing. This ringing have different causes. Example: if inner ear will be attacked, will be affected by virus, people can develop this dizziness and ringing tinnitus. But most of the cases of this tinnitus, the doctors having difficulties. It's drive people crazy. They coming to ear, nose, throat, ENT doctors. Driving, they checking all. You know, you're perfectly good. Okay, thank you. I'm perfectly good in this ringing, constant ringing in ear, drive people crazy. This is tension with masticatory muscles, and spatially with temporalis muscles. Here, it's like this. Ryan, can people see what I'm drawing? Or not really.
Yeah, but you're not the best drawer though.
Yeah, it's for sure. It's for sure. Yeah, this is the temporalis. Yeah, mainly points. We have to trigger points. By the way, talking on trigger points, guys, have to be discovered and eliminated. They must. Otherwise, to sustain results, impossible. It's impossible. You see, in any skeletal muscular disorders, usually, let's talk even on plain myofascial pain that development in upper back, for example. Yeah, little by little. First, it starts on level of muscles. this tension accumulating of muscles, and when muscles accumulating enough tension, these muscles start producing pain and dysfunction. In this case, let's say if this is a young person, meantime with fascia all is okay, all okay. Then muscles, tense muscles, disturbing blood supply to the fascia, and due to these metabolic disorders, fascia start accumulating tension. But look, here when cycle is closed and we're suffering or we're addressing my facial pain, my facial dysfunction, what happened? Muscles and spatial varus junction nerve and muscles will develop trigger point, pinpoint localization of pain, yeah? And then fascia will contribute. And then subcutaneous trigger points. It's pinpoint localization of pain. This is what trigger points are. And then periosteal trigger points will be developed. Guys, to achieve sustainable results, release of fascia mobilization, muscular mobilization, to address, investigate. We have to investigate, not to look at maps and trigger points, but we have to investigate, like here, compress, and your client have to tell you, oh, is here subcutaneous trigger points. You have to compress, grab fold of skin in area of painful localization, grab, and if client telling you, yes, this is compress it. By the way, I'm sorry, meantime we don't have technical ability to put model and to demonstrate, but probably I will produce some footage and I will provide Ryan with this footage of trigger point therapy all, and he will invite you to review again my hands-on demonstration also. But right now I just stressing importance to release tension within muscles, to release tension within fascia, and always secondary will be developed trigger points, and it could be in muscles, in fascia, on periosteal trigger points. They have to be eliminated, because otherwise you never will be able to sustain results. Let's say you successfully will release tension with fascia. Special techniques, you will release tension with fascia. You will release tension with muscles. If trigger points will be not addressed, symptoms coming back. In case we're talking today on TMJ dysfunction, very often in this area, more on, usually it's affecting periosteal membrane that covering bone, temporal bone, and mandibular. Yeah. One of the significant symptoms for this pain when chewing, when you're moving the jaw, you engaging the muscles, yeah. In this case, horrible pain mainly would be not only because of tension of muscles, not only because of tension with fascia, because presence of periosteal trigger points, and this periosteal massage, special techniques, they will allow to eliminate. Otherwise, even temporary will give some relief. It will come back and very fast. And of course, idea when patients coming to you with TMJ dysfunction, suffering from pain, when they're chewing, when they're talking, and this constantly, or tinnitus, or constantly, disturbing it, and this tension, headaches do not allow them to live. All this stress-related phenomenon. You see, if you will release a little bit the symptoms, and tomorrow it all will come back. People will not come back because they don't want to spend money. They're giving temporary relief, and they have to go to painkillers. Yeah, they have to really adequately. Please, Ryan, you tried to say something.
Yeah, somebody asked a question. Meniere's disease, does massage help with that too and stuff?
Pardon me, what?
Meniere's disease?
Meniere's disease.
Yeah.
Yeah. No, this is the this zooming. Yes, absolutely. Look, where is the power of massage? Power of massage is any muscular disorders where muscles obviously, muscular, for example, muscular disorders, it's sciatic nerve neuralgia. Sciatic nerve neuralgia could be results of muscular disorders when performance will compress sciatic nerve and will produce pain like pinched nerve due to herniation of disc. You see, yeah, all where is the muscle dysfunction, stress-related phenomena, all first making tension with the muscles. Yeah, absolutely, absolutely. This will eliminate dizziness because this muscular syndrome is producing dizziness also. This balance. Yeah, look, massage therapy is not remedy to all diseases, but I can tell it. I'm 43 years with passion and love practicing it, but it's so powerful. It's even not funny. Yeah, it's very powerful. When we're treating skeletal muscular or painful stress-related illnesses, and visceral massage. We have abdominal visceral massage. It's absolutely very, very effective. Must be, in my view, must be incorporated in treatment on most of disorders and diseases. Yeah, maybe not like a first door, although we are first door. Yeah. But,
and is there any special precautions for pediatrics then? Because with my daughter, she's 8 years old, and she's actually starting to grind her teeth.
She's growing teeth?
Yeah, grinding her teeth at night.
Yeah, you know what? First of all, my advice, start at least 3 times a week to give her massage, stress management massage. Just all these strokes that you're doing in Swedish massage and in medical massage, we're doing absolutely the same, just we incorporating 50% of time kneading. Start doing this. Massage a little bit masticator muscles. Soon, if you know what, soon I will produce, I have good record and expertise in addressing masticator muscles. Little by little, don't allow to this snowball, because you see this is stress, and this episode of bruxism, and this is so powerful, it's destroying TMJ, can in future to lead to constant chronic headaches. You don't want this. The kid have to have their own stress, and they have to study well in this. Start at least 3 times a week, and for sometimes 3 months, 4 months doing. Don't expect that you will give her one stress management massage, including you will address masticatory muscles and all it will go. You have to do this. Why we're doing repeated treatment in order to suppress sympathetic activities. This bruxism episode, this is overactive sympathetic nervous system. And this is against nature, because nighttime parasympathetic nervous system kind of dominating. It means she's taking a lot of stress to the bed with her, instead to sleep sweet dreams through all this bruxism. Yeah, stress management. This is what I would do. Stress management, just light touch, gradually kneading. Yeah. Back, legs, very important to the legs, lower extremities. Yeah. This is the way, and you can make big difference for her future.
Yeah, and the strange thing is, she's doesn't even have an ounce of stress at all. She's the most carefree person you'll ever meet and stuff, and it's like, I don't know where it's coming from.
You know what? She just acting. Then she's a good actress. She keeping this inside. If she gritting tears, yeah, she bringing it nighttime. There's no other explanation. She's something, Boris. She just millions of adults and teenagers. They know smile. How are you? Great. And this happy smile and not what going on inside. Yeah, yeah, it's for sure. I'll tell you what. One of the symptoms that will support what I'm saying, this that episodes of bruxism, and of course, dentists have to put this night guard, but measurement. First, do massage, good massage, and important, by the way. What you have to pay attention also. In neck, you have to address neck. What happened? Look, this is very hard working joint, but for 2,000 times, can you imagine? We engaging it, activating it. Now, when neck slightly, and due to the tension, neck will be flexed slightly due to tension within cervical muscles and upper back, and insufficiency of trapezius, for example, and erectors. Yeah. Little bit slightly. Now, work of TMJ is tremendously increased because gravity, like this, when I sit straight and I'm talking, it's slightly, few degrees, to 5 to 10 degrees. It looks like normal posture. It's not, and this is because to keep it straight, erected, yeah, it's difficult. Muscles just tired. Therefore, very important to massage muscle necks, muscle and upper back, muscles too, and TMJ. I look, like I tell you, I wouldn't leave it like this, because God forbid your daughter can end up with tension headaches, mood swings, tired, because she's not sleeping pretty well. Deep sleep, you know, it's different levels of sleep. Sometimes we're thinking we sleep, but we're not going into the deep brain regime, you know, to sleep. Yeah.
Yep. And then myself too. I mean, about a month ago, I started developing ringing in my ears and stuff like that. And
yeah, yeah. You know what? Go to my website. I hope your listeners, your audience, they have my website. Yes or no? Did you put? If you didn't put, write down. Let's to guys. My web, can I? Yeah, you always allow me, and you always promoting my website.
Yeah.
At the show, yeah. You will write also. You will put this on screen if possible.
We can't do it on the screen now, but when the video's done, yep.
Thank you, thank you. But guys, if you will go to, and this is also my recommendation to you, if you will go to www.medicalmassage-edu.com, you'll see lessons, free lessons. Put finger on this lessons, and you will find there is two types: instructional for professionals are demonstrating on models, and self. If you will click on self, you will find full protocol of self massage for TMJ dysfunction, including how to address pterygoid, medial, through mouth cavities, all in details. I show, you know, it's camera catching me pretty well, hands on. And Ryan, try to do it in this tinnitus due to temporomandibular joint disorders. When you will investigate for trigger point temporalis, all this must stick through muscles. You have to investigate careful, compress, hold. It could be latent slipping trigger points that not immediately will answer with, you know, in telling you, hey, here is the sharper level of pain. Discover all of them and address as I'm explaining. And you will see little by little this tinnitus will go away. You see, again, tinnitus is I believe tinnitus, is something Greek word, means ringing. Ringing. This is symptoms. A symptom. How we know that this is a temporomandibular joint? Close the ear, and if you stop hearing this ringing, then it's not a result of inner ear infection, viral infection. Virus can attack the inner ear and it will produce this irritating tinnitus. But again, massage, guys, it's not a remedy. It's not a remedy, but this is extremely, extremely powerful methodology of treatment. Extremely, extremely. Look, people with hypertension, panic attack, it's terrible diseases. Conventional medicine, pretty limited. in addressing to suppress different medications. They try to suppress sympathetic activities, but we with our hands doing this immediately. Any studies and most important clinical outcomes supporting it well. Yeah. You see, Ryan, using the opportunity, I'm pretty experienced. I'm doing this with love and passion for 43 years. And I'll tell you guys, and of course massage therapy is about results. You cannot be good if you will not a belief, you have to know, you will know that massage therapy is an extremely powerful methodology of treatment. You have to know, you have to come to the table every time with this kind of energy, you know, to this very powerful, every touch corresponding, you know, to the release of these potentials, action potentials within mechanoreceptors reaching brain. On my website you will find a lot of articles, and I am explaining physiological effect, how this works. You can to the point of imaginations. Yeah. Again, to be good and to deliver great results, guys, we must not to believe but to feel, to live it here passionately. I know that my touch does a lot, and this is true. I can assure you. But we have to live these procedures inside. Ryan, you want to say something? Okay.
I'm good.
Ah, you good?
Yep.
Yeah. Yeah. Okay. Let me briefly, guys, to summarize. Temporomandibular joint formed by two bones, mandibular and temporal bones. In the end of mandibular bone condyle, like this, it's a sitting piece of cartilage. Some people calling it disc, some people meniscus. Okay, this means the same. On this condyle, it's moving in this condyle. Dysfunction of masticatory muscles that holding and mobilizing in moving temporomandibular joint, leading to, it's actually main cause and is a cause for temporomandibular joint disorders. Actually, when arthritis start affecting and this cartilage start disappearing, it's like a shock absorber that it's moving. Yeah, is a secondary to muscular dysfunction. Secondary to muscular dysfunction, guys. You see, it starts on level of muscles, and therefore it's perfectly well. We treating is by addressing muscles, fascia, trigger points. We must trigger points in all type of trigger points. We have subcutaneous trigger points. We have motor trigger points. We have periosteal trigger points. All this, and you have to discover. This is our duty. Success laying a lot in discover all trigger points and to address them. By the way, on my website you will find footage. I'm explaining what is the trigger point therapy and how to perform. And there is few articles, more than 100 articles. And you know what? And you will find blog. And on one blog, I'm writing on if trigger points is real. Yeah, this article I believe will help you out to understand that this is real. I know in our community was a movement. No, there is no such a thing as trigger points. Why? Because from Australia, some rheumatologists, I was involved in kind of discussion with him on site, Australian side. He said, no, there is no such a thing, trigger points. I said, how can you say this? The histological study, it's well established fact. He said, yeah, because Trowell and Simmons, they presented wrong trigger points. I said, okay, I in a lot I agree. This is neurological origin information of trigger points. It's no doubt. Yeah, they skip it in this manual. So what? Does it mean that? By the way, this Trowell and Simmons is a great book, well presented anatomy, physiology, pathology, but this is not for massage therapists. Never was written for massage therapists. There is some concept that with this rheumatologist, he very active in body and mind, this Australian fellow. I saw a few of his articles. It looks like he is brilliant, but here he got kind of angry with Trowell and Simmons, and he decided that there is no such a thing, trigger points. In our community, big group of this, oh, there is no trigger points, guys. With no trigger point therapy, never, trust me, I never will make a habit. I daily see a lot of patients. First, my 20 years, I worked 11 hours a day with top Olympians. And you know, there is a lot of disorders and dysfunctions with no trigger point therapy. And again, this is our duty to discover all subcutaneous trigger points, motor trigger points within periosteal, trigger points within connective tissue also, all various pinpoint localization of pain that client can tell you, sure, it's there, or when you compressing, they're reporting localization of pain. This is trigger points. This is trigger points, you know, light compression, awakening trigger points, and here not, for example. Of course, this is pinpoint localization of pain, and you have to address, there's different techniques. Again, on my website, you can see trigger point techniques, and Ryan, probably we will have to work out something, footage somehow we will send to you in like follow up. You will show trigger point performances on temporomandibular joint. Yeah, we will have to do something kind of. Yeah. I'm in mood to share more and more my knowledge. Yeah. Again, guys, as you could understand, all this dysfunction, including development of osteoarthritis within temporomandibular joint, and of course, disappearance of this cartilage, all start on level of muscles. This tension within muscles, fascia, trigger points developments, all this can be early. You can prevent osteoarthritis not only within TMJ, with others. You see all this structure, including this disc, yeah, including tendons, including ligaments, including cartilage that covering these two bones. It's all connective tissue, including fascia. It's all connective tissue, and connective tissue are vascular structure. Connective tissue don't have vessels, but each cell of each connective tissue have to receive supplies, blood supply, and this blood supply is coming from neighboring muscles. It's called process called diffusion. And when muscles accumulating tension, again, I'm coming to muscular dysfunction, starting level of muscles. When muscles accumulating so much tension, of course, vessels within muscles also constrict, and these vessels reducing the blood supply to fascia and to cartilage, to ligaments, to tendons. What happened? Fascia start accumulating tension. Although fascia connective tissue fibers cannot constrict, it's just accumulation of tension, and became a constant irritator for muscles. You cannot relax muscles when tense fascia irritating it constantly. You see, all these horrible disorders that can lead to terrible surgery, such as joint replacement, all these disorders start on level of muscles. This is why massage therapy and appropriate applied protocols make our method great power in stimulating healing process and to eliminate all these dysfunctions and disorders. Yeah, and honestly, it's if talking today on temporomandibular joint, including tinnitus, and especially when I ask my clients, you know, can you close? Do you hear ringing? No, I know already where to look. Of course, I will address all chewing muscles, masticatory muscles. I will address neck and upper back. I always, today, last 10 years, I'm including in any orthopedic massage, I'm including stress management. Impossible to sustain results otherwise. We so overstress all of us. This information here is text, and here is email, and here is the hearing, and here you're working on a computer, and here you, at the time you're answering this. I don't know if our brain originally designed for this multiple function. Results, terrible stress, and the stress management more powerful than massage. You will not find methodology. Yeah. Again, guys, I did a little summary. It's difficult. I would love to, if camera would be able to show me a model to work. Maybe we will find some technical answer to this. We tried. It's meantime it didn't work, but who knows? We will not give up. In any case, I will stay in touch with Ryan, and I will send to him footage he will be able to put on his site and to announce you, to come and to learn all trigger point, mobilization of muscles, connective tissue massage, which is fascia. Yeah.
Yeah, and do you actually massage inside of the mouth sometimes too? Then.
Yeah, we have pterygoid medial. Okay, I will clean my finger. Let's pretend. Yeah, you have to go through mouth. Pterygoid lateral, we're compressing a little bit, and when squeezing the jaw in at a time, like 3-4. We're addressing pterygoid in a little bit, kind of this type of kneading. Yeah, but pterygoid median and all this, the mandibular branch, for example, of trigeminal nerve, you have no other choice. You have to go through mouth, and you have to find these trigger points there, and this muscle you have to address. Again, on my website, where is the self lessons, where I'm teaching self lessons, there I'm teaching how through capacity, through cavity of mouth to reach pterygoid medial and to compress it. And to compress, and I explain how to do it. Yeah, the most important not to overpress. Any trigger point therapy have to start by gradually compressing. Even this will be subcutaneous. We have to gradually. When clients said, "Oh, it's enough," don't judge. Just stop, and during 10 seconds threshold will be increased, and then you can reach second threshold of pain. Yeah? And holding like this is classic ischemic compression for 30 seconds. Then you remove, and you go and you look for other trigger points. You look for periosteal. Where is the exit? You have access to bone. You have, and here we have a lot of accesses to bone, to temporal and mandibular. There's something important I almost forgot, guys. Temporalis. The fibers of temporalis go like this on cross. Therefore, when you're addressing temporalis, try to address like this and from up and down. And when you do kneading, so also in always stroke for up, down, up, yeah, like this, like this. We have to consider that fibers is because temporalis involved in all these multiple functions, fibers going cross across. Yeah. This is important also. But my main message is to brief you on this temporomandibular joint dysfunction and to know, and I hope you trust me, that massage therapy is very powerful in these methods. And again, just think of give me the example, muscular syndrome like this. I know doctors are addressing with injection, and does it work sustainably? And in most cases, this injections is a hormone. It's corticosteroid, steroids. Yeah, no, because again, simplicity of massage and great power made our power method is very, very powerful. And it's very, very powerful. Yeah, very powerful, because in most cases all start on the level of muscles and have to be addressed on level of muscles successfully in details. In details, focus on what you're doing, with your hands, focus, try discovering trigger points, compress them patiently. You see, I'm very patient when I work. I'm not boring. I'm opposite. I'm performing art. It is art. Each client, even the same client, repeated treatment is different. There is need of to create, to feel, because all tension with muscles changed, and maybe trigger points. One will slipping trigger points will become kind of acute active. We also have to discover, boom, absolutely new location, and we have to. It's always focus of this time of the treatment. It's full on hands and to sense of touch, to see with your hands what eyes cannot see, and this is. And then successful with this. It's different energy exchange, different, always different.
And do you get into energy work much then?
It's good question. Okay, remember you started. Yeah. Look, science of massage and biomedical science do not deny energy work. Cannot deny. Why? Because even that we see each other, this is electromagnetic impulse. We hear each other 24/7. In our body happened electrical activities, and especially rules think on brain. These electrical activities. Now, it's absolutely simple physics, biological physics, including that if in body happened electrical activities, doesn't matter, it could be a non-organic object, you know, some rotator, means around electromagnetic fields. You producing these fields and I. When I put hands on you, right, and I know you sprained lower back, whatever, yeah, and I know right now this all inflamed, and inflammation to imagine is not difficult. To see with your hands what you cannot see with your eyes. This is what energy work. You imagining through your senses, sense of touch, excessive amount of fluid accumulation, lymphedema. Then you start working. You see how you pushing it with no enough anatomy. You pushing it out. Then all what you're doing, physiological effect. I actually 20 years ago introduce our society to physiological effect. We can explain it. Scientists developed this, not Boris, this explanation. Every hour movement creating electrical activities under hands. Releasing potential. This potential is that's living within mechanoreceptors. When we mobilizing soft tissue, we deforming it in releasing it. It's all this stimulating central nervous system. Stimulation of central nervous system brain cannot be unnoticed. Immediately reflex. Massage therapy is reflexive therapy. Coming reflex such as, for example, muscles delayed, drop detention. This order coming from lower motor centers due to our stimulation. Vessels delayed. Mechanically we're pushing out stasis of venous blood mechanically we're pushing, and accumulation of extracellular fluid. We're addressing causes of pain. Now, the moment when you deeply understand what you're doing and you see with your hands, you're creating absolutely different electrical activities within your brain. And of course, your electromagnetic field is different. And this is the energy war. This is, I gave this simple example how I'm practicing here. By the way, on my website, please find an article under title Science of Massage and Energy Work. I explaining it pretty plain. Yeah, there is different energy works, guys. I was very young, 40 years in school, and our professor wrote lady. Her name was Juna. She became very famous. They used to call her extrasense. Famous because conventional doctors couldn't take care of Leonid Brezhnev, was the chair of Communist Party, and he was kind of literally dying. She came to him, okay, and she did something like this and started moving with no contact. She performed this energy work and he got better. This why she awaked some interest. She became famous. No one would question. She held the top communist in Soviet Union, and she awaked interest to all these methods, including medical society. My professor brought her to our school, and I saw she did something. The placebo is excluded. Patient even didn't know that she doing it. He was sitting with back to her and through curtains. She did something like this with hands first, and then she started moving, and he even experienced pain at the time when she moved. All we saw it, but how he moved, and then he reported that he's much better and can move his arm. How many of us have this gift? This is the greatest question. By the way, recently, she explained to us how to do. We tried, but recently one of friends of mine said to me that what Juna did, this is kind of Japanese method of energy work. You just, guys, you can try. You just move your hands. You're creating like a ball. You will feel this hot temperature, and then you like applying this ball against painful spot and providing therapy. How many of us can have this gift to do? I don't know. I'm questioning. They ask me if I can. I tried a few times and end up putting my hands and doing what I'm doing the best. Yeah. But to deny energy work at all, there is a lot of course, we have to reject charlatans in our business who's starting, extracting money from people. No, but at the time, don't rush kind of deny energy work. We don't know. Whatever works. Yeah, whatever works. I don't know. I with no contact, I tried to do, and I felt I have to put my hands to do. But at the time of performances, of course, I am incorporating energy work. It's my senses, imagination, and my senses. Of course, different electrical activities in my hand is so much innervated, so many nerves, yeah, that you just cannot not release these electromagnetic fields and incorporating in treatment. I know this. I know that deep understanding to the level of imagination. I can do better. Yeah. By the way, guys, just take your hands like this and try like this. Create ball. Maybe some of you will feel this ball, and then this ball just move around. Is with no contact. Japanese doing, and Juna did with no contact. Yeah, like this. Yeah, you created this ball. Oh, I feel warm. Really, I'm not lying. Or maybe I'm convincing myself. And then against, yeah, whatever works, guys. Now, I believe, Rance, sometime with you I talk privately or on show, because if massage therapy, you brought the question, if massage therapists should advertise the services of energy work. In my opinion, I said to you, my opinion, look, we have to reject charlatans. Now, if somebody, for example, doing like this, I don't know what is Reiki, for example, but I was told that Reiki, not touching even the person. You don't touch, and something like from this type of, like this healer Juna did. Then this is not a massage. If somebody practicing hands-on massage, but also kind of good expert in Reiki, I don't know, really, I don't know, never thought. Yeah, he shouldn't advertise Reiki services as a massage. It's not ethical to convince a massage. Traditionally, soft tissue mobilization by hands. You see, and if client come and he knows that he will receive Reiki, there's nothing to do with massage. The moment when hands-on mobilization of soft tissue not involved, this is not a massage. Yeah. Now, if somebody practicing massage and also does, like for example, creating this ball and start, and somebody ready to experience it, but you have to make clear this is not a massage. It's not ethical to call this massage and to hold license of massage therapies and to promote it like this. No, honesty. I don't know if this even required license. If somebody not touching client, why to require license? But no, don't call this massage. It's not a massage. Nothing to do with massage. Yeah. Any questions?
Nope. No other questions right now from the
audience
like that. So.
Yeah. Oh, you see how it's important to develop. You have to think how technically we can put me in front of the camera that live people will see it. Yeah. We tried with this laptop. It didn't work. Yeah, but we probably will get one. Some technology will allow us, and it will be great. Then will be live show, because talking is talking. But yeah. By the way, guys, in soon you also go to this One Concept convention in San Diego, yeah? Right.
Yeah.
You go, yeah. I will be also. I will present role of medical massage in treatments of whiplash type injuries, multiple region, because of this nature of this brain strain shaking to different axes and plan. I will present this, and at the exhibit hall I will have table, and probably I will have treatment table. If you're planning to be, it's in a week, I believe, September 26th. Yeah. Yeah, you're welcome to come to say hi to me. It's in San Diego. Who attending? It's promising. I never attended to this. I never presented. My only experience in America during 20 years is World Massage Festival, and I had 5 days of great fun there. Yeah, but this is supposed to be something very good. One concept I like. I like one concept, guys. I like we too divided. And this to me is a symbol, one concept. We have to, integrative medicine, integration of different methods. We have to, for the sake of our clients who are suffering, guys, we have to work together. There is no champions. And by the way, in my opinion, there is no advanced therapy. Guys, there is no it's 10 years ago it started, advanced therapy. There is no advanced therapy. There is advanced performances. Individual performances, how much hard you will put, and all these slogans, revolutionary slogans, there, advance, advance, advance. Yeah, no, there is no advance. You see, more humble you will be, more honest you will be, more you will develop this sense of touch. This is, it's not championships. That if I run faster 100 meters, I am the champion. No, in our business, all this. Egocentric ego. I don't want to use bad words. Yeah, it's not. It will not fly. It's not. We in healing arts, guys. Tolerance, love, respect, and sharing knowledge to advance each other. This is what to advance skills, to develop results. This is what is advance. Massage therapy about results. Once in my life, I saw old gypsy lady. That she even couldn't speak Russian well. Yeah, born in Russia, and all her life she spent in Russia. She even talked broken Russian, and she never got formal education. And I saw her performing massage, orthopedic massage for sciatic nerve neurology. She did all perfectly. She did introductory part, what we're doing in these cases. She pumped out the accelerated drainage of venous blood and lymphedema reduction techniques. But it was kind of improvisation, but perfectly fitting. And I knew will be results. And then she somehow pulled to the side fascia, yeah? And then she mobilized muscles quietly. She didn't press crazy. She compressed pinpoint localization of pain trigger points. She never was trained formally, guys. Okay, who was advanced? She was advanced because fellows stood up from table feeling much better. Feeling much better. Compression of nerve was, sciatic nerve was obviously less. Therefore, yeah, if you will attend one concept, yeah, oh, there is time still to get. Please come visit me at the exhibition hall. I will have table. I will present to a short presentation, and then I will be at the exhibit hall. Ryan will be there. We will do some educational event. Yeah. And what we will use? What cream we will use? Right.
Bombatel.
Bombatel. We will use this cream. Yeah. No, I'm serious. No, cream is not bad cream, by the way. Not bad. You know, Bruce once gave me samples. It's not. With jojoba, how am I? I'm promoting Bon Vital cream with jojoba. This is what I have experienced in. Yeah. You know, I'm good, yeah, to promote it. I'm telling the truth. If this cream wouldn't be good, I wouldn't utilize. But again, if you will be in San Diego, come to us. Ryan will be there. I will be, and we will do some educational any topics. I will demonstrate hands-on on spot. If you will ask me, being this neat, I will share my knowledge to the best of my knowledge. Yeah.
And then what other seminars and stuff are you doing the rest of the year?
I'll do. You know what? Honestly, we didn't organize. It was, again, we're right now working to remodeling our website. Actually, my partner is the technical fellow. Yeah, but I was kind of very busy to organize seminars. But I'm planning in Nevada, Las Vegas, in November to teach with Chicago. Meantime, I didn't organize. I have to think more of continuing educations. You know, Ryan, what I would love to do, and I have, you see, I have two cousins in this business. They're MDs, but medical massage practitioners. Dr. Rostov-Chinenov, he located here in Arizona. Today we're talking too much. Forgive me, I'm telling this is my opinion, nonsense about pain management. And you know, such as there is no such a thing. Pain receptors, all pains generated by brain. You know, all this. It's really nonsense and dangerous. You know, to spread this is pretty dangerous. We have to think to do conference, but really people, scholars in the business, not like one decided that he developed or she developed a new method from nowhere and then teaching this method and promoting nonsense. I would love to do real pain management, role of medical massage in pain management, or role of massage in real conference with introducing concept and the most important hands-on. You see, I'm right now spending time with you. I'm enjoying, guys. I know you're seeing me. I cannot see you. Yeah, I'm enjoying, but it's like I'm feeling my hands have to demonstrate. Yeah, have to demonstrate, to teach hands-on, to teach quietly, to share my clinical experiences. This is my desire. Yeah, we have to do something. We will think. I will convince you, right?
Yeah.
One day I convince you.
And what's the best way for people to get a hold of you then?
Please, you can write to me email, support@medicalmassage-edu.com. You can write to me email. Yeah. You welcome to visit my website. A lot of information. By the way, I'm very proud. I'm offering a lot of free lessons, articles, blogs. If you will look on the left side, there is blogs. A lot of blogs. I believe there is good content to learn. Guys, I'm sharing very rich academic and clinical experience. Very rich. I believe in, like I gave you the example of this gypsy lady. She, to me, the most advanced massage therapist in the world. Safe and effective treatment she performed. I don't care if she never was trained. Yeah, I don't care. I practicing massage therapy. I actually successfully practicing for 43 years and teaching more than 55 protocols, hands-on protocols. All these protocols were developed by scientists through research for massage therapists. They produce for us ready products. Each of us can contribute. I'll tell you the example. I just recently was involved on my Facebook site. I was involved in talking with one fellow from Texas, and he asked, guys, who experiences working with cerebral palsy, and yeah, where I can take seminar on this, and immediately in my head, cerebral palsy was affiliated with babies, newborn babies, you know, in first years of this. And I said, listen, if somebody will tell you that he can teach it, you first of all ask where this person learned, what is clinical experience, because today is wild west in our community. Everyone teaching in more than 1,000 created in 10 years, more than 1,000 different methods of massage. It's impossible. It's insane. It's just impossible. It have to be stopped. It's dividing us so much we even cannot talk one tongue. Yeah, but during this, I was a little bit overreacted. I'm sensitive when I hear all this, you know, repacking and introducing material. This fellow said, you know what? It's probably his client or relative. It wasn't clear. You can find on my page. Boris, you know, for 40 years, she's adult. 40 years, she tried everything, nothing. And I started doing massage in silicone jars. I developed method of connective tissue massage using silicone jars. And I'll tell you what, in a few treatments it started helping. I learned so much. And I said to him, thank you for this. You see, he contributed to my knowledge. I thank him for sharing the look right now for some patients with cerebral palsy. And I will perform treatment using silicone jars. We have to, again, everyone can contribute, guys. And we have to talk language of massage to stop all these alternative names. We have to stop it. It's just unsustainable. Yeah. Look, go to trade association. How many we offer in different names, and you will see this. You know, in a national board. Oh, there barely you read massage, yeah, and we have in trade associations, for example, American Massage Therapy Association, Massage Therapy Association. Look, what's being created. It's just wrong. It's cannot divided house cannot be sustained. Yeah, and we have to stop. Who does massage with hands, soft tissue mobilization using hands, is massage therapist. Period. And there is different modalities could be incorporated. But again, you feel free, support at medicalmassage-edu.com. Feel free to write to me. Go to my Facebook groups. It is Medical Massage Facebook group. Yeah, you can Boris Prilutsky. I also have timeline. Yeah, and yeah, post questions. We can continue our discussions, and of course. And also, oh, by the way, you please write to Ryan what topics you would like to, from sciatic nerve neuralgia to thoracic outlet syndrome. No headaches today, we a little bit discussed plantar fasciitis, hip disorders, knee disorders, arthritis, all these topics, whatever, you know, detoxification program. It's extremely important. Real detoxification program. Yeah, I have a lot of experience in this, and we can do show on this topic. Prepare upfront your questions. Yeah, and we'll do shows if you will have desire and to listen. If most of you will request, for example, sciatic nerve neuralgia, then of course Ryan will schedule with me, and again we will try to do it as much as possible educational. Footage we'll send to Ryan. He will be able to post, show to show you. We'll be delighted to share with you my knowledge. But you need to contact me.
Well, thank you very much, Boris.
Ryan, always the pleasure to be with you. I really enjoy it, and I hope we will do something, something good.
Yep, and thanks everybody for tuning in.
Thank you, guys.